I want to take a look at some of the things about the coronavirus. You might say it doesn't connect with the show. It does on a couple levels. This is a show about public health interventions, and it's important to understand how you can prevent yourself from getting these diseases. And I also like to look at some of the background of things. So I want to take a look right now of really a background that's not getting a lot of attention in the media. And you can follow me on the internet. The NewYorkPost.com put this article out. And what we're looking at is I want to inform the listeners a little bit about animal hosts and the numbers. And this is obviously the most famous public health issue going on at this time. We spent about 50 minutes discussing gun violence, and right now we don't see an overlap between gun violence and the coronavirus. But sometimes when resources get short, people result into personal violence and create armed conflicts. So experts have confirmed, and I'm reading from New York Post, the deadly coronavirus began at a wholesale animal market in the central Chinese city of Wuhan. Now, what I want the listeners to listen for here is coronavirus has an animal host. Scientists with the Chinese Center for Disease Control and Prevention said tests show that the pneumonia-like virus initially jumped from animals to humans at the Hunan seafood wholesale market. Citing China's state-owned Xinhua news agency. I don't know if I'm pronouncing that correctly. When I used to come on public radio in Connecticut, they would give us the phonetic pronunciations of things, and so do all the anchors who come on the big network shows. The now shuttered market, which sold live animals including wolf pups, foxes, rats, and peacocks, had previously been reported as the epicenter of the virus. 31 of the 33 positive samples were collected from the western zone of the market, where booths of wildlife trading concentrated, the CDC said, according to the news outlet. The results suggest that the novel coronavirus outbreak, and that means that a couple of things here. The coronavirus is endemic to China, meaning that they live with certain lower rates of it. The novel coronavirus outbreak is highly relevant to the trading of wild animals. The virus has killed 80 people so far and infected more than 2,700. Meanwhile, Chinese authorities temporarily barred the training of wild animals Sunday and promised to severely investigate and publish those who violate the ban. So they listed a few animals here that were being traded, but I want to go and look at some of the species. And so what you're looking at is, if you're following me online, you need to know some of the vocabulary. Animal hosts of the coronavirus. That will get you a list of some of the animals who are known to have the disease. Now, this article appeared in the USA Today on February 7th, and it lists some of the animals. And I want the listeners to know, are any of these animals or their related species indigenous to the United States? So, one of the animals known to host it is called a pangolin. So what is a pangolin? I did not know, but when I saw the picture, and if you go to usatoday.com, you can see that it looks like an aardvark or an anteater. A Chinese university says scientists identified the heavily trafficked pangolin as a possible intermediary host of the new coronavirus. The coronavirus in China is believed to have originated in bats and transferred to humans through some other animal, health officials say. The pangolin may be the key link. Researchers say at the South China Agricultural University. The latest discovery will be of great significance for the prevention and control of the origin of the new coronavirus. Notice both of these articles say the new. Again, this is relating to endemic disease, a disease that has existed on a much lower rate and on a less lethal level. All of a sudden, it's spiked in terms of burden and prevalence and virility, meaning the types of symptoms that are lethal and make you sick. The research team tested more than 1,000 samples from wild animals and found a 99% match between the genome sequences of viruses found in pangolins and those in human patients. So this article appeared in the USA Today. So when I mentioned mayhem, right now many of us are on lockdown, and it relates to the original theme. We were discussing how females are more likely to be likely murdered in a family domestic situation, and we were discussing the psychopathology of some of the men who commit this crime. But connecting the word mayhem to our show today, and of course our show is a public health show, we want to take a look again at some of the preventions that are out there for the general public that can easily be implemented. And that's also been a theme of my shows over and over again, that so much of public health common sense rules can be applied to a person who wants to say, hey, how can I stop this from happening? What are some of the things that can be done? So I'm going to read a couple of them in the time that we have left. If you just tuned in, we have less than 5 minutes of our show, and you're listening to Victims to Victorious. Today's episode is Female Fatalities, Murder, and Mayhem. And because the biggest public health issue right now is the spread of the coronavirus, I'm spending a few minutes on that. So if you go to the cdc.gov, Angel, you can see, yes.
I do have a question that's related to the coronavirus. So I was just reading that thousands of people are hitting the Florida beaches. I guess it's spring break. I'm not sure, but the report says that thousands of beachgoers have flooded Florida's beaches. Now, what do you think about that in the midst of this coronavirus epidemic?
Well, I think it's analogous to what Governor Cuomo was worried about, and the governors of Connecticut and New Jersey, is all of a sudden they looked around and they saw people were off at work, but they were crowding bars and restaurants. So when the beach gets crowded, social distancing also applies. That's my first reaction. My second reaction is we don't know so many things about the virus, and so that for some people, being at the beach seems safer than being at the restaurant or being at the mall. But we really don't know that. And then what would be the role of water and lack of hygiene at the beach? So I disapprove of it. I think people should realize that if you are congregating at the beach and lying down right next to a stranger, you are in fact putting yourself at risk for infection, because you don't know what the other person has. That's what. And then all the people who get to Florida, how many of them have been on the airplane? How many of them have been on the train or the bus? Air travel has not technically been shut down. The airports are just kind of vacant. How many people were you in contact with at the airport? How many people were you in contact with, including the TSA agents? Those are questions that I would have, Scotty. So no, I don't approve of it, and I don't think it's safe. Does that answer your question?
Yes.
All right, so we're going to go back to a couple of things about preventing it. So the main thing is stay home. So let's just talk. They're not staying home. I know you don't live on the beach. You know, you paid your spring break money, and these travel agencies should be ashamed of themselves. They don't want to lose money either. So you get on the plane and you go anyway. What we might see, Scotty, is that if people in the age group who are not at risk for getting the more virulent strain, meaning getting sicker, If we're seeing that more of them are congregating, we're actually going to see more of them get sicker. So they're not outside of the containment model. So if you are listening and you're wondering about some of the containment connected to Scotty's question, stay home if you're sick. Stay home if you're sick. What else does that do? If people in your home get sick and one of you tests positive, it allows for contact tracing, which has not been successful at this point. What does that mean? If someone in your home has been staying home from work for the last week, etc., becomes sick, now the public health officials know who got sick, when and where, and who they were exposed to. Contact tracing will allow them to channel resources to test people. Right now, even though there is drive-through testing in some places, it's not available everywhere. So stay home if you're sick. Cover, cough, and sneeze. Wear a face mask if you are sick. And there's some discrepancy over which type. Yesterday I had to go out. I couldn't find my paper face mask. I actually put a scarf over my mouth. Okay, so get a face mask. Make one if you can't go out. Limit where you have to go. You do not have to go and buy a new pair of jeans right now if you're at home. Stay home. Clean and disinfect. Clean and disinfect frequently touched surfaces. So there's some confusion within the health department, public health departments, as to how long does the virus live on a surface. But they are convinced the virus does live on hard surfaces. So even if you're at home, disinfect doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. I'm taking the Lysol disinfectant and spraying on the doorknobs when I come in and out of the bathroom. All right? So those are some of the suggestions. And, of course, normal hand washing. If you're at home, you don't have to use the hand sanitizer. You can use real soap and water. So those are my suggestions for protecting yourself from the coronavirus, staying out of the mayhem of this pandemic with self-regulation. And, of course, public health models can be provided by the Public Health Department, the Centers for Disease Control, but ultimately you need to implement them themselves, including reducing your risk to gun violence. So that's all for today's show. I want to thank my sound engineer, Scotty Reed. Follow me on Twitter, On Air Angel. Visit the BlackTalkRadioNetwork.com website. Click a button to donate to the Black Talk Radio Project, and I'll see you next week.